Okay, good morning. This is the House Appropriations Committee. It is Friday, May 2nd, 2025 at 11 a.m. And we have with us Vermont Legal Aid to talk about their federal funding challenges and community impact. So we're delighted to have folks with us. And if I pull up the agenda. So if we've got two folks on the screen, if you would like to introduce yourselves, Yasmin and Samuel, and then we can go around and introduce ourselves. Thank you. Because I don't think you've been to our committee before.
I do not think so.
Okay, so if you'll introduce yourselves, then we will do the same.
Yes, good morning. I just want to thank you for giving us the opportunity to appear before you today. My name is Yasmin Tweedar. I'm the Executive Director at Vermont Legal Aid, and I'm here with my colleague.
Good morning. My name is Sam Abel Palmer. I am the Executive Director of Legal Services Vermont. We're the partner agency to Vermont Legal Aid, a little bit smaller, but we're the agency that receives the Federal Legal Services Corporation funding. So we work very closely together with Vermont Legal Aid.
Great. Thank you both for being here. And since it's been a while, Dave, why don't you start?
Hi, greetings, Dave Iacoboni, Lamoille, Washington District.
Good morning, John Kosenska from Burke. I represent the Essex Caledonia District.
Hi, Mike Nigro. I represent Bennington and Pownell. Tom Stevens from Waterbury, representing the Washington Chittenden District.
To my left will be coming when he's at another committee now, Jim Harrison from Chittenden, and I am Robin Scheid from Middlebury.
Tiff Bloomley from Burlington.
Trevor Squirrel, Underhill and Jericho.
Hi, I'm Mike Nowicki, and I'm the representative from the Wyndham 4 district of Putney and Dummerston.
Lynn Dickinson, I represent St. Albans Town.
And also missing at the moment is Wayne LaRouche, who's from Franklin County up by Richford, Berkshire, Franklin, and
Highgate.
You got 3 out of 4. Would that help? All right. So thank you for coming, and we look forward to hearing what you have to say.
Yes, good morning. Thank you for having us and for giving us the opportunity to talk about our funding, particularly threats to federal funding, which I think are causing anxiety for nonprofits, both locally, regionally, and nationally. I just wanted to give you a little bit of a background about Vermont Legal Aid. We provide free civil legal services for low-income Vermonters. And every day our attorneys work to advocate for fair treatment, access to benefits, housing, healthcare, safety, and economic security for thousands of Vermonters. Today, I want to talk a little bit about the critical funding issues that we're facing, particularly as funding becomes uncertain. And we're also facing a funding cliff in connection with pandemic era funding, which was critical to sustaining our work and will ultimately affect our ability to serve Vermonters who rely on us for legal help. Vermont Legal Aid's impact reaches statewide. We have 5 offices: Burlington, Montpelier, Rutland, Springfield, and St. Johnsbury. We provide direct representation and advice to over 15,000 Vermonters. And our services address the most fundamental needs that people have around stable housing, healthcare access, protection from violence, economic security. And without legal aid, Vermonters would face these challenges alone, with devastating consequences, not just for them, but for their communities and for the state's social service systems. As you'll see today, what makes our current situation particularly concerning is a combination of increasing legal needs among Vermonters and declining federal resources. So this is our current federal landscape. Our annual budget is approximately $12 million. Almost a third of that is federal funding, with a substantial portion coming through a combination of the state and other sources, including nonprofit organizations and other private funders. And while state funding is our foundation and plays an important role in our funding, federal funding plays a crucial role in our ability to provide legal services. Like I said, it covers about a third of our organization's funding. And my partner will talk about this to some extent, but some of the money that comes through Vermont Legal Aid is ultimately subcontracted to Legal Services Vermont, which is our screening services arm, and they also provide legal services to the community. So any financial impact to Vermont Legal Aid ultimately also reaches Legal Services Vermont and the communities that we jointly serve. Even before these federal threats, we were already facing the scheduled end of the pandemic funding, which has supported our housing and homelessness prevention work. So this is particularly devastating in a time where we're experiencing a housing crisis and increased poverty within our state. This is a federal funding breakdown. So there are 3 ways that we receive federal funding. There are, of course, our direct federal grants where we get the grants directly from federal agencies, but then some federal monies also pass through the state and then pass through nonprofits. So we recognize that there can even be challenges on the state level in terms of funding. 12% covers our HUD, IRS, and CAP grants, which are under the most immediate threat presently, since those are direct federal grants. And then 43% comes through state agencies that receive federal funds and then subcontract with us, like our VOCA funding, which flows through the Center for Crime Victim Services, and then 45% comes through nonprofit organizations like Disability Rights Vermont. So while different in their channels, these funding sources originate from federal agencies, making them vulnerable to cuts, and obviously has widespread impact. I wanted to talk a little bit about pandemic funding, since we have the pandemic funding cliff. And I was hoping that this pie chart could give you a sense of kind of the impact of just the loss of pandemic funding, and to make it easier to understand, since we often get grants in multi-year terms, I broke it down by year so you can understand what the yearly impact might look like. Our home ownership legal assistance project was approximately at $436,000 per year. That ended in December 2024. This is a very important project, particularly since Vermont has one of the highest home ownership rates. And this project protected folks from losing their homes to foreclosure, but also did assist with some estate planning and helping heirs to be able to get access to deeds for properties that they've inherited. Public Health Workforce is another grant that was around $129,000 a year. That one ended in December 2024. That grant supported some of our disability rights work. And then one of our biggest grants was our Housing for Everyone Law project, which is dedicated to preventing evictions within the state of Vermont and assisting folks with accessing rent assistance. It was a 3-year award that breaks down to approximately $1.09 million per year. So in pandemic funding alone, we would be experiencing a loss of approximately $1.65 million, which already has a huge impact on our organization. So like I said, these are the grants that are at the greatest risk because they're directly through federal agencies. These are the estimated amounts for each one of them. As you can imagine, each one of these agencies has faced several cuts, particularly to staffing, which impacts our ability to even receive grants. I know for HUD, I had sent multiple emails in connection with one of the grants we had applied to, never got a response. And I think that's just a demonstration of slashes to staffing and how that at minimum produces delays. So anticipating delay of funding, but also a likelihood of termination of funding or a lack of fulfilling the grant, particularly since this project deals with fair housing work. In this particular project, we have about 2.5 positions. And so loss of this funding would mean a loss of these positions. And then our IRS grant the tables show about a 25% staffing reduction, which would ultimately impact the funds that we would receive there. And then our client assistance program is at risk also, given the cuts to the Department of Education.
We have a question here.
Yes, I just wanted to know, are these grants that you regularly get on an annual basis?
Yes,
Okay.
if they're funded, yes.
And we have heard from others about agencies, HUD and other agencies, federal agencies, where they're not hearing back, or the people that used to be there aren't there anymore. So you don't actually have the contact that you had before in the relationships. So.
Absolutely. And it's not just that, it's also exacerbating clients' ability to reach people in connection with issues that are impacting them. So the effects are felt throughout.
Yeah, Tom.
And one of the effects that we've heard from the Human Rights Commission with the loss of the Housing Discrimination Law Project money is that Vermont Legal Aid can't represent clients. It can't work in tandem. They can't, that a lot of the people who are being affected or who might call you are calling the Human Rights Commission, and also, which is also under stress. Is that you've pretty much lost that relationship for the time being? Is that right?
I mean, it's absolutely strained things. I think there's pressure. Sorry, Sam, it looks like you were gonna.
Yeah, I can speak to that specifically since we run the helpline. So we're the ones who are essentially turning away all of those housing discrimination calls. We would normally have sent them over to Vermont Legal Aid to get assistance. All we can tell them is try calling the Human Rights Commission directly. So we absolutely have been sending many more people that way because of our inability to assist them.
And do you have an idea of how many people since January 1st or since whenever the funds ran out to now? Because I mean, they're gonna get a worse message when they call the Human Rights Commission about the inability to be represented. As well.
I'd say we probably would be sending a dozen to 20 every month over to them at this point.
All right, no, that's unfortunate. Thank you.
Thank you. And like I said, while we have some direct federal funding streams, that there are also some pass-through federal funding that come through to us. So we have a Vermont Ombudsman project where 60% of their funding is federal, which would mean a potential loss of 700,000 or more. That would be the equivalent of 5 to 8 full-time positions. On average, the cost of an attorney is somewhere in the ballpark of $180,000. What this would mean for the VOP project is that they wouldn't be able to fulfill their mandate to visit long-term care facilities for sure. And then our disability law project also receives some funding through the protection and advocacy funds at $415,000 that would end work for children with disabilities. And then our elder law project receives grants from area agencies on aging. And that amount is around $249,000, which impacts services for Vermonters over 60. The elder law project is funded under something called the Older Americans Act, and that was administered by the Administration on Community Living. And the elimination of the ACL threatens funding for this particular group, including critical legal services. That particular ACL has been dismantled as a part of a broader reorganization within the Department of Health and Human Services.
Dave?
Do you have available the numbers that go with the impact, for instance, with only 3 ombudsmen? How many people did you see or complaints did you deal with annually? Same thing, if you could give us any kind of numbers on disability law and the elder law project, are those numbers available or?
So I think we can pull that data. I just don't have it on hand, but what I can do
Okay.
is circle back to the committee with the, I guess, per FTE, what sounds to me like a per FTE, and how that impacts X number of clients, correct?
Yeah, it helps make it more impactful to me if I get a sense of how many Vermonters won't be served.
Okay, I can
Thank
circle
you.
back with that.
Yep, thank you so
Thank
much.
you. No problem. So as you can see, these funding challenges come at a time when we're experiencing a housing crisis, increased poverty within the state, but also experiencing this regionally and also nationally. There's been a 45% increase in evictions over 5 years, a 43% housing calls increase since 2019, 25% no-cause evictions, surged housing cases from 10%. And these numbers represent real Vermonters facing homelessness, like the family in White River Junction that we represented, who faced eviction from their apartment of 17 years, or the single mother in Burlington who was illegally locked out of her apartment in the middle of winter. Without our housing attorneys, many of these Vermonters wouldn't have any place to turn. A lot of these numbers are also included in our Vermont statewide legal needs assessment, which I think I also sent over. Was there a question?
No, you can continue.
So I thought it was important to talk a little bit about the human impact and the clients that we serve, because despite these statistics, they really impact the lives of our fellow neighbors. Last month, our attorneys represented an elderly couple in Franklin County who faced eviction after their landlord attempted to raise their rent by 100%. They had lived in their apartment for 11 years and had nowhere else to go. And through our representation, they were able to remain in their home with a fair rent increase. Our ombudsman, for instance, helped a nursing home resident who had been left in dirty clothes and bedding with staff failing to properly feed him. Our intervention ensured proper care and restored his dignity. And a mother with severe disabilities called us when her landlord refused to allow her to have a live-in aid. And through negotiation, we were able to not just get approval of the aid, but also a transfer to an accessible apartment. Without Vermont Legal Aid, these Vermonters and thousands like them would be facing these challenges alone.
100% rent increase proposal. I would like to assume that 100% is not common, but Vermont has no bar on how much a landlord can raise rent, correct?
That is my understanding, yes.
And is the 100%, I mean, obviously you can't go any higher on the spectrum of a rent increase, but I suppose you could, but when cases like this where landlords are evicting based on, somebody not being able to pay the increased rental costs, is there an average percentage that you can share with us on when cases like this happen?
Since we run the helpline, we kind of see the broad spectrum of numbers. It's really, rent increase per se is not probably the biggest issue. I think that does come up occasionally and can really be devastating to individuals. But even in the course of just kind of a normal expected level rent increase that was properly noticed, the problem is that a huge amount of the available housing is just not affordable for low income people. The rents, both rents and housing prices are just, given the huge increases that we saw during the pandemic, they have not come down. And it's, we used to be able, when we were working with folks who were in unaffordable housing, prior to the pandemic, we'd be able to, negotiate a move out where they could then move into a place that they could afford. Lately, there just aren't affordable options for people to move into. And that's been our biggest challenge.
Continue, yeah.
Yeah, so I mean, the cost to the state of Vermont, I think, is profound when legal aid is not available. And here are some demonstrations of what that impact can look like, further exacerbating homelessness and poverty within our state, which comes at a cost. Higher public assistance, increased risk of crime and family instability. Having folks navigate the criminal justice system alone is always terrible, and leads to injustice for our neighbors. And then one of the things that I always talk about, having come from a clerk position, is the increased burden on the court system when you have a backlog in a docket. So I've observed pro se litigants many a time, and how many hours it takes up from a court's time when it could be serving other litigants before it. And so it's extremely inefficient and overburdens our system. And ultimately that has a cost to the state. So I've shared a little bit about the funding cliffs we're facing, some of the risks that we're facing in terms of federal funding. In coming to you to share a lot of this, we've already taken some steps on our end to try to take some cost-saving measures to maximize retention of staff in fiscal year 2026. That's proving to be quite a challenge given the funding losses, which is why we're sharing with you all of the difficulties that we're facing financially. But internally, we've been trying not to fill vacant positions. So in other words, we work internally in terms of reassignments, but ultimately, you know, when you fail to fill a position, it also means loss of services to the community. But it's just a necessary part of trying to keep our staff, trying to keep our projects together, and still try to provide services to the best of our ability. But we're also looking at operational efficiencies where we can cut back on expenses. We're also looking at trying to consolidate office space. It's really important for us to have that physical presence throughout the state, but also it costs a lot of money to rent office space. But despite these efforts, like I mentioned earlier, the average cost per position is around 180,000. That's the general cost for one of our attorneys. Because of the funding issues, we're at a high risk of staff reductions in fiscal year 2026, which will impact several areas where Vermonters are particularly vulnerable: housing, disability, elder law, victims' rights, family law generally, taxpayer advocacy, and then long-term care advocacy. This is a funding request we had made before in the legislature, and we kind of broke it down by areas of need. It's a little bit on the conservative end. In order to try to maintain legal services, we did expand with pandemic funding, but even the expansion wasn't really enough to keep up with community needs. But we're also experiencing losses because of the pandemic funding losses, and there's also heightened need in certain projects. And so I've laid out kind of some of our requests in each of these projects with dollar amounts, which amount to approximately 1.6 million. And I know there's been a study about this before, but for every dollar funding for legal services, there's an $11 return. So there's a cost savings inherently built into investing in legal services. Prevention of emergency housing, expensive reduced healthcare costs, fewer court resources required, long-term family stability are some of the ways in which an investment in legal services positively benefits our communities.
Yasmin, was some of this in the budget? Was this request made before the budget?
Yes. Yes.
So what is in the budget as it's come out of the Senate? Do you know?
My understanding is that I'm not sure if the final numbers actually came out. Have you heard anything, Sam?
I have not gotten those statistics yet.
We suspect level funding, but we're unsure.
So is this 1.6 million in addition to whatever is funded in the budget?
correct?
Correct, it would be an increase to our base.
Was that requested at all during the course of the budget passing through both bodies? Yes? I'm just trying to.
I know we went through housing, and I believe we also went through the Senate.
Okay.
Oh, sorry. This is the legal needs assessment that we did some community visits to some underserved areas and interviewed with folks within those communities. And this report was put together, and I think it has some really important information. I included it in the materials that I sent over, but to summarize some details from the report, it highlights that housing issues have reached a crisis level, which I think is important to note. And legal needs increased substantially in the last 5 years. Our call volume is up. And family law still remains one of the high unmet legal needs areas. I believe it's number 2 after housing. And then healthcare navigation continues to be increasingly complex.
Great.
And so we're just reiterating our $1.6 million request to bridge the gap, to maintain critical housing stability services, protect vulnerable Vermonters, prevent greater downstream costs, and ensure access to justice for all Vermonters.
Okay. Any questions from anybody? This was very helpful. We really appreciate you coming in and talking to us. Anything else you want us to know at this point?
I mean, I don't know if you want me to, I can fill in a little bit of kind of the additional perspective from Legal Services Vermont and some
Okay.
additional funding streams, if that's
Sure.
useful.
That would be great. Thank you.
Yep, no, happy to do that. And so, as I said, we're a smaller partner agency to Vermont Legal Aid, but we're kind of the front door agency for a lot of the people looking for services. We besides representing a lot of people in many areas, we also run the statewide helpline and the statewide legal information website, which gets an enormous amount of traffic, about 600,000 page hits a year of people looking for legal assistance and information. We're, as I said, the recipient of federal funding through the Legal Services Corporation. And that, our budget is about $2.5 million, and about a little bit less than half of that comes through Legal Services Corporation. And, this has certainly been, a tremendous area of further uncertainty on our end. This is, our base funding. It is the core of how we do our work. But it is federal funding, and certainly, we are watching developments day to day about what's going on. And the kind of the good news is that Legal Services Corporation is one of these separately incorporated independent agencies. It is not literally an agency of the federal government, and so it's been a little bit insulated from some of the attacks and the cuts that we've seen in some of these other agency-based grants. However, as we've seen, there have been some successful attempts at dismantling those private independent agencies. If you followed the events around the U.S. Institute for Peace, where the administration came in and essentially dismantled that agency, even though it was an independently, separately incorporated one. And so we're very concerned about what this could mean, and that would have a broad national impact if that were the case. So that in itself is causing a tremendous amount of uncertainty at the moment. Congress has level funded LSC through the rest of this year. What will happen after that, we do not know. But we are very much dependent on the whims of Congress and the administration as to what actually is going to happen with that funding. But that is, as I say, that is our core funding and represents about $1 million a year that we receive from them. Wanted to highlight one other, or actually two other ways that this has impacted us directly. In 2023, we, through the Legal Services Corporation, we received a grant to respond to the summer flooding that that people experienced in 23. And with that, we were able to provide 2 staff members to help quite a large number of people get through the process of applying for FEMA, appealing all of the denials from FEMA or the underfunding of their requests. And we were definitely able to create a tremendous amount of support for the communities that were impacted by the flooding. In 2024, when we were hit again with the flooding, we applied for that grant again and submitted all that information to Legal Services Corporation, and they let us know that they absolutely were going to fund us for that work, and in fact told us that they wanted to give us more money than we had even asked for, except Congress didn't appropriate it. And this was just this last year, and for the first time that I can recall, I mean, every year Congress has appropriated supplemental disaster funding for the Legal Services Corporation, and this year they specifically did not. So even though it wasn't a grant that we received that we were cut out from, it would have represented probably about $500,000 over a couple of years in funding to help disaster victims that we did not get. So that's been another kind of concrete example of where we're facing these restrictions on both our funding and on the work that we're able to provide. Very recently, we had just worked with the state office of the Child, Youth, and Family Advocate to get a fund through the Department of Health and Human Services to provide early intervention legal services to families at risk of DCF involvement. And that would have been probably about $75,000 a year for us for 5 years. Literally, as we were heading to a training down in Boston to prepare for this work, we got the word that HHS had just shut the spigot off on that money and that it's gone. So another, again, chunk of money that we were going to be using to kind of backfill some of the existing losses, and that got cut off just a couple of weeks ago without any warning or notice. Yeah, so we're in a very similar boat to what Yasmin was laying out, and the other piece of the puzzle from us, as Yasmin mentioned, is that we subcontract with Vermont Legal Aid for about half of our budget. So the impacts that they're going to feel are definitely going to trickle down to us, and we're going to face similar restrictions and potential layoffs next year if without the additional funding.
Just some high-level guesstimates. At minimum, a few $100,000 has been sent over LSP's way. And so just to reiterate the impact that any funding cuts to VLA would ultimately impact our partner, Legal Services Vermont.
Dave, go ahead.
Well, just a quick comment that I wanted to get on the record. I took the liberty of reading the Vermont Ombudsman Annual Report. Ombudsman is a Swedish word meaning problem solver. So they address 600 complaints statewide in nursing homes, residential care homes, in the home. And just the thought, to me, it's more than a stark picture of the condition of things. But if you've outlived all your relatives, you're alone in a nursing home, somehow you register a complaint that you're lying in dirty bedding, and there's nobody there to answer the call. If that isn't sobering, I don't know what is.
Yeah, and I've had the pleasure of working with those folks for many, many years before I was in my current position. I worked in the Disability Law Project at Vermont Legal Aid, so we worked closely with the ombudsman folks. And you know, it's even through the pandemic, they were going into facilities in person. They're really frontline. They, you know, and they are. It's that ability to literally go in there, do the in-person visits, see the conditions. They do amazing work, and it would be a devastating loss.
I,
I'm sorry, I just have a quick question that's an immediate follow-up to that. Is the ombudsman basically contracted through the state to provide that, those visits? And I mean, are they acting in place of the state essentially?
That's not my understanding. I think it is, I mean, it's a national federal program. Every state has an ombudsman office for long-term care. It lives in different places in different states. In some states, it is housed within a state agency, but I don't think that's ever been the case in Vermont. I think it's always lived at Vermont Legal Aid.
And I was just going to add earlier that I shared some of the story from the ombudsman, but there are countless stories where they go into these facilities and they deal with such compassion and restore dignity to folks and help preserve their rights in a way that's truly inspirational. And I agree that it would be a devastating loss to have any cuts to these services, given the very important work that they do for folks who are receiving long-term care.
Thank you. Okay. Any other questions or comments from anybody? All right, well, more sobering news. Thank you for all the work that you do. We really appreciate it. Vermonters appreciate it.
Thank you.
Thank you for giving us the time to meet with you today and to share with you a little bit about the work we do and some of the successes, but then also the challenges that we face.
Thank you very much. Really
All
appreciate
right.
it.
Thank you.
Very helpful. Take care. Okay.
Thank you very much.
Thank you. Have a great.
So committee, this is it for testimony for today. Just want to let you know, we're going to start to be getting some more bills coming in. H230, we're going to get next week. That'll be yours, Trevor. It's coming from Environment. H126 will be coming from House Healthcare. That's the hospital and healthcare transformation stuff that's going on. It's pretty complicated. It involves a lot of moving parts. They're making some big decisions today, as I understand it. So if you read something this morning, it could be very different at the end, but you might take a look over the weekend. And I would suggest that you talk to people on the committee if you have questions, read the bill, don't assume you understand it. Talk to your hospital or, those kind of things. So
Actually, going back to Capitol Plaza right
Yeah.
now, because there's a group there that's meeting. It's sponsored by Vermont Area Association of Hospitals and Healthcare Systems, and it's all the CEOs from the hospitals here. Not all the hospitals necessarily, but trustee members as well here. And Devin Green's kind of represents them here in the State House, and she's been tracking all that stuff
great.
very carefully here. And there's a lot, obviously, that both committees in the House and the Senate understand about this. They've been working on this, getting lots of testimony here. But I have to say, I don't think a lot of us know all the details, and language matters. And I think that's a big part of what they're trying to come to at a point in time here. I know Green Mountain Care Board is working very hard here to grab the bull by the horns here, so to speak, and try to help manage this here. And they are bringing the hospital partners together at a point in time for different aspects of this here. But that's the group that kind of, gives approval for budgets and spending and things along those lines. So we're just trying to come, I think, to a better
So it affects
place.
Green Mountain Care Board, it affects hospitals, it affects, lots of things.
All
So
of us in our backyard.
pretty big,
It's a
complicated
big
bill, and there's been a lot of hearings about it and joint hearings and lots of testimony. So you're also welcome to go take a look at it. We are not going to we're not gonna debate all the policy here in this committee, as you know, we're gonna, that's not would be our job. Yeah, I know you never do that. There is some money in the budget right now for that, so that's part of why it needs to get out, so we can see what's decided and how that impacts the budget in the committee conference, so. We'll see how that goes, but that's probably the most complex one that's coming that I'm aware of in the next week.
There was actually three things that came through. One was about the 340B program, which helps to kind of buy down the, retail costs of pharmaceuticals here for patients here. That's been taken care of here. So protections from there, but there's two other things here. They're one, S126 is one, and H, I forgot the number, I'm sorry, is another one. It's a little bit less
Yeah.
complicated bill, but the larger one is the Senate one.
Yeah, there's reference.
So
based pricing
just
in
encourage
there.
them to kind of read that.
Things like that,
Do ask
so.
questions.
Yeah, and definitely ask people who understand it better than any of us on this committee, because we haven't been around it all the time. And I think there's a lot of misconceptions about what some of this stuff means. And also some things are gonna take a long time to roll out. You don't just turn on a dime when you're changing
It's kind
certain
of a
things.
2-year time.
Yeah.
Things, but the larger conversation here also is about the solvency here, Blue Cross Blue Shield.
Well, and the solvency of some hospitals too.
Yes, the larger one is the Blue Cross Blue Shield.
Yeah, it depends on the day. I've been going to some meetings about this.
Yeah, I know you have.
Yeah, so anyway, just want to give you a heads up on what's coming. I think there'll be some other bills coming as well. And as I find out about them, I'll just share with that so that you can all start getting a sense of that. We had two bills that were, well, Mike, I don't know why after they asked us to vote on that, they didn't ask you what our.
I know, I was waiting.
I was.
I almost
I was like, what's going on?
I was gonna do a point of order for you, Mike. Point of order, Mike.
Yeah, that's right. Mike has something to say. Yeah, and we did. I don't know what happened with that, but anyway, especially since Connor was the one who asked us to do this.
Right.
So I'll go give him some grief later. And then Trevor's bill was pulled back and is gonna be happening.
If it's gonna happen at all.
Oh, you don't think it's gonna happen at all? It's
I said-
postponed till May 8th at this point.
There's a question about that.
This is still, all right. So you're keeping an eye on it.
That's
So
a
this-
chloride bill?
Yeah, the salt bill, yeah. The other salt, not state and local taxes. So this is the time of year when we're gonna get bills, they're gonna start, they're gonna stop, they're gonna go back to committee, we just never know from moment to moment. So that's where we are on that. Committee conference is gonna meet at 1. Also, speaking of healthcare, Jessica Holmes is a member of the Green Mountain Care Board, is also a professor of healthcare economics. And she has her students who've been doing a whole lot of research on healthcare. And they are doing a poster presentation in room 11 from 12 to 1. When she wrote me last night to remind me about it, she said one of the groups called every single primary care
Really?
practice in the state of Vermont to find out what the wait times were. And nobody has done that. They have the only data of that. I don't know. I mean, we're gonna have to go.
I'm
find
going
out.
over,
Yeah,
yeah.
so I suggest going over if healthcare is important to you in any way, and just see what they're up to, because they've done a lot of
Yeah,
research.
it's impressive.
Okay, thanks.
Yeah, so what is primary care? It's independent, it's FQHCs, does it include people that are employed at the hospitals, like nurse
You'll have to
practitioners?
ask them who they called. I don't have that information. So this is a good opportunity, especially with this bill coming toward us next week, to talk to some folks who've done some real, primary research, some good research. So, all right.